Thank you. Thank you, Sue.
You're welcome.
I really appreciate everybody being here tonight. It is a couple of months ago, the national organizations had come to us that there was a concern with some changes that are coming to Medicaid. And I said to Sue, we were talking, we we have to reach out to Healthy Connections and start building a relationship. And I'm really glad, I'm just very honored we have Ayesha Coney with us tonight from Healthy Connections, who's going to talk about some of the changes federally that are coming down from Medicaid. Um, Out of respect for our speaker, please mute yourself. And if you have any background noise, try to really reduce that so she doesn't have to compete for the rest of us for us to hear her. So without further ado, thank you so much, Ayesha, for joining us. And we just really appreciate hearing, our membership really appreciates hearing from you.
You are very welcome. Thank you for having me. Good evening, everyone. My name is Ayesha Coney, and I am a training supervisor with the Eligibility, Enrollment, and Member Services with the Department of Health and Human Services, Medicaid. So I have a brief presentation that I will be doing. Is there there's another view, Sue, that you can, you're sharing it. I think if you do, not the presenter view, but there's another view.
I'm going to unmute myself. Sorry. Yeah.
Okay. Yeah, there's two different views. I think one is the presenter view. It's the other one. I can't think of it off of the top of my head.
Right. Let me try this again. I was trying to.
Okay. No problem. There you go. That's it right there.
This is the one you want?
Yep, that way. Perfect. So yeah. Can everyone see the screen?
Hang on a minute. I got to get it to, it's got to go bigger.
Okay, no problem.
Let's go. Why do we always have these issues right in the middle of something, right? We're not advancing. Oh gosh, let's try this again.
Yes.
Okay. We just did this 5 minutes ago. Everything was working just fine. But let's try it again. Let's see.
If it's showing the other way, Sue, that's fine as well.
It's not, if it's not in this other larger view, it won't advance. That's my problem. Well, you can see it here, right?
Right, we can see it.
If I advance it this way, will it go?
Yeah, that's fine.
Okay, sorry about that. For some reason,
there's no issue at all.
Okay.
All right, so I'm just going to briefly discuss our annual review and our standard review process, since now the public health emergency is ended effective May 11th of this year. So we are now processing reviews. We've held off on reviews due to COVID. Now we are processing reviews as an agency. Just a little background, we have not processed reviews since March of 2020. We are starting to process these reviews now. However, we have started off with our MAGI categories. When I refer to MAGI, that's our modified adjusted gross income. So that's the children, pregnant women, families. So we started off with those. Those rolled out beginning May 1st. Now we are looking into, and we're starting to do the training beginning June 1st. We'll start with our non-MAGI categories, and that's our aged, blind, or disabled individuals. And then we will roll into our long-term care individuals, those who may be receiving a waivered service or nursing home type of care. So our goals, so our agency goals is listed right here. So we want to promote the continuity of coverage for eligible individuals. So anyone who is eligible for Medicaid coverage, we want to make sure that they can remain eligible for that coverage. We have hired a lot of staff. And we continue to hire a lot of staff to make sure that we can process these eligibility reviews. We have a lot that have been going out, so we want to make sure that everyone is getting their reviews done in a timely fashion. Us hiring more people has allowed us to limit delays in our redetermination process. So you can go to the next slide. This next slide shows the different key dates in our activities. So back in December of 2022, the Consolidation Appropriations Act was signed, and that basically said we are going to have a PHE end date, which they discovered would be May 11th. February 15th, that review distribution plan came into play. So CMS said that it is time for everyone to start sending out these reviews. March 31st, continuous enrollment requirement expired. April 1st, the standard annual eligibility reviews will resume. So April 1st, we started sending out those reviews. On April 8th, we did have a baseline report that we are sending to CMS. And then May 11th is the actual date that the federal public health emergency ended. So that was just last week or 2 weeks ago now. We can advance. All right, so our review process. So in March, the agency sent out pre-review notices. Something new that we've done is we started doing text messaging. So we started sending text messages to those that we identified that may be eligible for an upcoming review. April 1st, the first reviews were initiated. That first week of April, the first continuation of benefits notices and annual review forms were mailed out, as well as text messaging. So we just let people know, hey, we've identified you. You may be getting a review in the mail, just to look out for that. The first week in May, the first disenrollment notifications began. So effective coming up next week, May 31st, we'll start closing out people. Reviews are mailed out 60 days prior to them being closed out. We don't tell our clients this, but they do have an actual 90 days. They have a grace period that will keep their case open so that they do have time. Because again, our goal is to make sure that we can get everyone who is eligible for coverage, make sure they're eligible for coverage and continue with that coverage. And then June 1st, they'll start setting those closures for those who have failed to return the review form. Going forward, each month, there's going to be an electronic data that's going to be used to see if we can keep someone eligible for coverage. Again, reviews will be sent approximately 60 days prior to that redetermination date for someone who, if our caseworkers are unable to verify through our electronic data sources that they can continue for coverage. Clients who do not return the completed review form within 30 days, they will receive a notice that their coverage will be ending. However, again, they do have up to 90 days to return that information. So we want to make sure that they do return that information. All right, so our review distribution plan. So we have a plan that goes across 12-month period. So states have 12 months to initiate these redeterminations and then 14 months to complete the work. The distribution will begin with groups likely no longer eligible. So for example, if we have somebody who was pregnant back in 2020, we still kept them on, they were still eligible for coverage due to the public health emergency. Well, now we'll look at those people and send them a review to see if anything has changed. They may be pregnant again, but we have to see if anything has changed within their household that makes them ineligible for that coverage category. So we are looking at that. And again, as I mentioned, we did start off with our MAGI categories. Another category in our MAGI is Partners for Healthy Children, a PHC category. So that's a child who was under Medicaid coverage and they were getting full benefits. Well, those benefits end once they turn 19 years of age. So due to PHE, they were still getting that coverage. Well, now they may be 21, 22 years old. So that's somebody who is aged out of that category. So they're no longer eligible for coverage. So those are the people that we've identified first. What we have been doing, though, is doing an ex parte for people who are getting reviews. So instead of just taking them off of the program, if they're eligible for another category, we will input them, we'll ex parte them into another category. And then we'll also send them a review to see if they meet any other categorical requirement. You can advance to the next slide. All right, our communications plan. So we've done several, we've been on the news, we've been on the radio, heard on the radio, done a lot of community outreaches. So just several different ways. We have newsletters so people can understand the importance of these reviews coming out. We want to make sure that we can reach everybody so that we can keep their coverage going if they are eligible for coverage. You can advance to the next slide. All right, so again, this just shows that we've done some presentations. Something that is very important is going to our website, that apply.scdhhs.gov. So if you go there, you are able to change an address and contact information. Changing an address is very important simply because if we send out these review forms, we want to make sure we're sending them to the correct address. So if you have clients or you know somebody, make sure that their address is updated, and they can do it themselves by going online. You can also contact our member contact center Monday through Friday, 8 a.m. to 6 p.m. That phone number is 888-549-0820. So that is our member contact center, or you can go to any local eligibility offices. Our offices are co-located with DSS. So a lot of our Medicaid offices are inside of DSS buildings as well. And then, like I said earlier, we are doing text messaging if somebody has a review that's coming up. So there's several different ways that we have tried to notify our clients of this important change, this review process that is coming up, or that is taking effect now. You can advance to the next slide. And then again, it just is very important to make sure we have an updated address. You can either do that yourself by going to our website or contacting our member call center. So those are just different ways. And another way, if you're a provider, then you can contact that Medicaid provider service Monday through Thursday, 7:30 to 5, or Friday, 8:30 to 5. That phone number is 888-289-0709. And that is what I have. Do I have any questions?
I have one question. So if
Sure.
somebody, so we had an individual that called and said, "Oh my gosh, I got my letter," and that he did not, he aged out. And so I, he's like, "What do I do now?" And so I sent him, to the marketplace. He wasn't sure if he, could afford that. But I guess that's my question for you is where do we tell them to go, or do you help them with a letter, like if you say, "Hey, you've now aged out or you don't qualify," do we help them get somewhere from there?
So yeah, the letters do, some of the letters, they do say that, hey, you may be eligible to go to the marketplace. So apply, and there's like a link, to tell them to go to that federal marketplace if they are ineligible. Again, we've trained our workers though, to make sure if somebody is not eligible in that category, let's see if we can ex parte them into another category. With your client, how old was he?
He was, I think, 22.
Okay, so yeah, so he aged out of that PHC category. And so now, another thing is if he, a lot of times we may have somebody who became disabled. So if that person became disabled, then we would keep them on for coverage until we sent them over to our non-Magi side to see if they are truly disabled, and then maybe ex parte them into a non-Magi category. But otherwise, due to his age, he doesn't meet that categorical criteria. Therefore, he would be ineligible for our Medicaid services.
And one other question, does the marketplace, do you guys have anywhere, this came up the same thing, do you have people that the navigators still, so that if they leave that and then they got to go to the marketplace, that there's a navigator, somebody to help them with that?
There are still navigators, and they are, and I can't think of the name of them, but there are people in different agencies. And if you remind me, I can get that information to you. But they do have, there's some, I can't, it starts with a Q. I can't think of it right now, but there are some people who are out here that are still doing navigators, and they're helping people apply using the system.
Okay, perfect.
Hi, this is Renita. I have a quick question.
Sure.
So what happens if they move from South Carolina to North Carolina?
So if they move from South Carolina to North Carolina, they would no longer be eligible for Medicaid services in South Carolina. They need to apply in North Carolina. Even if they're just in Rock Hill and they move to Charlotte, Medicaid is only it's issued by state. Therefore, they wouldn't be eligible. They'd have to be in the state of South Carolina to be eligible. That's one of the non-financial requirements.
Oh, okay. And does it take like a few months and stuff, or would they just disconnect them from South Carolina?
Sure. Once they tell us that they've moved, then we'll close them out of coverage so that they can be eligible in another state, because you can't have Medicaid coverage in both states.
Gotcha. Okay. Got it. Thank you. You're
welcome.
Hey, I have a question. I'm sorry. I was trying to look for where you raise your hand, but I don't see where we can raise our hand on here.
Caleb, Dana, go ahead.
Okay.
Next.
Okay. So some of our children in our bleeding disorder community are on TEFRA Medicaid. And, usually we get a renewal notice with that. We have not received one. We've not received anything in particular on our son who just turned 19. Now, his case manager said that his Medicaid would stay active through age 19, but what you said was it stops at age 19. So we should have received something.
You would not have received anything yet because we haven't done TEFRA yet. TEFRA is a specialty unit, and that's handled with our non-Magi. So that is actually coming up in June. So that's coming up. We have not touched TEFRA yet. What I was referring to was a Partners for Healthy Children. That was a category. So whom you're referring to was in a non-Magi category. So that's TEFRA, that disability. So we have not rolled that distribution plan out yet.
Okay. So, and that would explain why some other parents hadn't gotten theirs.
So they haven't received anything. It's just focused right now on pregnant women, children that were in Partners for Healthy Children.
Okay.
And those are the children that age out at 19. Then our parent, caretaker, relative. So that's either the parent, caretaker, that could be the aunt, the uncle, the grandparent. That's someone who was on Medicaid because they had a child in the home under the age of 18 years old. That's what made them eligible for coverage. So we're focusing on those people right now.
Okay. So, all right. For TEFRA, does that age out at 19 or it ages out at 20, what the case manager was telling us?
So TEFRA does age out at 19 years old, and it depends on that disability. And again, that's handled by a specialty unit that we have. So but you will be notified well in advance. Just make sure your address is updated so that they can send the proper paperwork to them.
Okay. And then on the business end of things, so this is making sense on the business end where we bill Medicaid, and we would check some eligibility and they would be active, but in the pre-COVID world, they would not be active anymore. And we couldn't figure out why the system was still saying they were active. And then once we billed and got the statement back, Medicaid had actually paid. But now what you're saying is it's making sense because of COVID and the public health emergency order.
We've stopped it. But everybody was riding smooth with Medicaid for the past 3 years now. So now everyone who's been identified, they'll get that review and see if they're still eligible for coverage.
So in the future, later this year, when they come back for a service, big possibility it's going to show them ineligible.
Correct.
Whereas 2 months ago, they were eligible.
They were still eligible. Yep.
Okay. All right. Thank you. That makes a lot of sense.
You're welcome.
Holly, do you want to have a question? Go ahead and unmute.
I think this is more towards you, Sue, than for her. But if you are not able to navigate Marketplace or have anything through them because it's a little bit more expensive and you are not able to get back on Medicaid, would you be able to do the HAP, I want to say it's HAP program through the Hemophilia Center?
So the HAP program is for anybody that has absolutely nowhere else to go. That's our hemophilia assistance program. You're not eligible for Medicaid, Medicare. You don't have a job that can, or you don't have enough income that you can, or a job that has insurance for you, or you don't have enough income to apply for the marketplace. And it's just a matter, you should go ahead and go on there and apply.
Okay, because I know I've used it in the past when I moved pre-COVID, obviously, from New York to South Carolina, and we were having issues with the Medicaid. So I was just wondering, because I know that was an issue, or that was a concern last year with the financials of the programs, that could be a cut for everybody because not a lot of people know about it. So it's like trying to get the word out in case you're not able to with Medicaid phasing out. But on another note, the raise your hand is in the reaction button. Yeah. So just a heads up.
We've been back active so much now. It's almost like, how do we do the Zoom again? We have to kind of learn all that.
I actually got on my phone with it the first time, and I'm like, no, I need a bigger screen. So I chose my Chromebook. So, and then I had to navigate through the Chromebook.
Awesome. Does anybody else have any questions? That was very good information. I really appreciate that. And I appreciate you helping us understand. And, you know, now can we contact you if we have a question?
You sure can.
We have your email, we have your phone number now.
You have my email, my phone number. Please feel free to contact me at any time.
Perfect.
I do have a question.
Sure.
Yeah, my question is, when you said that you age out at 19, does that mean that it's the end of 18 years old or the whole year of 19?
You age out when you turn 19, so the end of 18. So once you turn 19, and that's just for Partners for Healthy Children. I just use that as an example because that is one of the categories that we're looking at right now. A lot of children that were getting Partners for Healthy Children, they're now 21, 22. So they've aged out. They're no longer categorically eligible.
All right, thank you.
You're welcome.
Explain what you mean by Partners for Health. Is that just regular Medicaid? I mean, it's
full Medicaid coverage. So what happens is, if I choose, it's based off of our income. So in order to qualify for Medicaid, you have to meet 3 different criteria. You're financially eligible, so you have to meet those income guidelines. You have to be categorically eligible, so meet a category. And then you also have to be the non-financial, so be like a South Carolina resident. Right. So with the income part, so if I have a household of 3 and my income meets that guidelines, I'm just going to throw out a number. If my income is under $30,000, although I'm over for Medicaid coverage, my child will still be eligible if that income limit was $30,000. Therefore, my child would get full Medicaid coverage. I wouldn't have to get insurance for my child. I wouldn't have to get like the family insurance because my child would get Medicaid coverage. So you'll see a lot of people that they don't quite meet that parent, caretaker, relative income. That income for a household of 2 might be like $1,100, I'll say, a month. So if they're over that income, but they're under the $1,500 a month for the PHC, then their children could qualify for full Medicaid coverage. That parent won't get it, but the children will get the coverage. And I just made up those numbers off the top of my head. So, but yeah, and I can share that policy manual with you. Tomorrow, I can send you our income guidelines so you can see that, as well as a 1-pager. Normally when I do presentations, I provide a 1-pager. It's front and back, but it has our MAGI categories as well as our non-MAGI categories. Just a brief summary of each of our categories.
That would be wonderful because I can get those printed and put them out and have them in the office. And
it changes. Yep. And the income limits change in January for our non-MAGI side and then in March for our MAGI side. So everything I have is up to date, and I'll make sure I email that to you tomorrow.
Awesome. Thank you so much.
You're welcome.
Anybody else have any questions? Jim, you want to close us out?
Well, I want to thank you so much, Ayesha. You were fantastic, and we really appreciate you joining us. If Ayesha, correct me if I'm wrong, but the most important thing our community should do if they are receiving some kind of Medicaid benefits, make sure that their address and is up to date currently. So we can't emphasize that enough.
Yes.
So that's okay. So I know that was a big deal as you're getting around to the different categories, making sure. So I'm going to leave with a plug, please. If you are for utilizing Healthy Connections or any Medicaid program, please contact them and make sure that your address is up to date.
And if you do find you have that letter and you're ineligible, give us a call. We'll I'll get you over to the HAP program. My only concern with the HAP program when we're having people go is it's only, there's still room right now, but it's not an unlimited resource of funding. So that may be something that we might have to go back to our state legislators and say, hey, due to this fact, we've lost a lot of people, eligible, and they need that help. So that's one thing but do call me and I'll try to or call Jim. We'll try to get you where you might need to go. And thank you for the navigator, because I did have somebody ask and I said, well, I think they still do, but I didn't. The one thing bad about the marketplace is when you start to go play with it, you get 900 phone calls. And so for me, it's like, ugh, I don't want to do it to get the information. So that was great. So I told someone to kind of put a fake number in there, kind of play with it and see where you're at and see if you can, see if you can basically qualify. And then I will let them know that there are some navigators because they were very concerned about that.
Yep, they're FHQs, I believe. I'll find out the exact term, then I'll get it for you.
Perfect.
Thank you.
I have one more question. If you've already, or that you've already got the letter for the review and you cannot find the paperwork for it again, are you able to go online and do the annual review form?
Yes, you can go online and complete the review form yourself. We have a tool also that's fairly new where you're able to upload the documents. So if we may be missing like your income, a lot of times, I'll just say income, it's a scanning tool and you're able to upload those documents. So you don't have to mail them in or send them back to us. So you're able to do all that online.
And Ayesha, would you get a response once you go online so that you can know that they got the documentation?
I believe it does say that they've received the information. Now, I would contact that 888-549-0820 number to see the actual the progress, the status of that.
Okay.
Because that's when the call center, they're able to see if somebody has worked it, if it's been scanned in. So I would call that number, the member contact center, to see if it's actually been worked.
Okay, great. Thank you.
You're welcome.
And I do have one last question on the disability patients that are actually on disability, Medicaid, Medicare. Will they get a renewal now, or are they still where they are like every 5 years or whatever they had on their renewal?
So they will get an annual review starting in June. So we'll identify those people. And we're actually having a training tomorrow to see exactly who's going to be identified in that. But yeah, they will start in June. They'll start identifying those people who are the non-Magi and the long-term care people who will start getting those reviews.
So pretty much everybody's
going to get a review now. Yep. And so it will go back to having an annual review. So we do reviews annually.
Okay. Perfect.
And something else, because you mentioned like the 5 years, a lot of times people will see when they're applying, they can check the box, they want to review 5 years, 4 years, 3 years. It still does an annual review.
Oh, okay.
Yeah.
I have a question. Can you hear me?
Yes, ma'am.
Okay, if we just had an annual review in like February, so will we have another one?
You wouldn't have had an annual review, because we didn't start reviews. We just started sending out reviews.
So it's something, an annual review, tell me, go ahead.
The annual review is where we're able to see who's still in your home and if there's any income changes. So the form, the form will have your information pre-populated on it. And all you'll do is just make sure, yep, my address is still the same, my phone number, this person still lives in the home, or this person has moved out of the home. So that's what the review form does. It just lets us know we're just recertifying the information that we currently have.
Okay, so I guess this was a phone call from somewhere else then, because this.
And what could have happened is somebody could have applied for coverage, and if we were missing some type of information, then we would have called to get the information so we can make sure that person's going to be eligible for coverage. But we haven't done any reviews. We just started sending out reviews in April.
Okay, so you're saying that, so this was from, because they already on disability. So
okay, so that may have been something from Social Security. That may have been something different.
Okay, that's what I want to know.
Yep, that may have been something different, or if somebody alleged disability and we're trying to make sure that they were still disabled, things like that. But that wasn't a review, an actual review form.
Okay, so now what's coming out is another to say this review form, or what is it going?
So now the review form will actually, if somebody is for somebody who is currently active in coverage. That's what the review form is, for someone who is currently active in coverage.
Okay, and they were on disability, but now the review form is just to go and see if things.
It's just going to update that information, correct?
Okay, then.
And that's
But this
June.
I
think that's what she said, June. Those should start coming in June. So kind of keep an eye out for that in June for the disability.
Okay.
And this is Medicaid disability, Ayesha, or this is just Medicaid partners?
Medicaid,
I think you said.
Yeah, Medicaid for everything for Medicaid.
Right, okay.
Warning has been issued for your location.
Oh gosh, this was great information. I got a whole bunch out of it myself, so I really appreciate that.
I know.
Get that information out. So I just thank you all for being on. We'll let you get on with your evening. The rest of you, let me close down the